3M has 4 different resin-based cements. The first one is the RMGIC, which is the resin modified glass ionomer cement, which is promoted under the name of RelyX Luting 2. The second one we have is RelyX U200, which is the self-adhesive dual cure resin cement. A third one, which is RelyX Ultimate, is their adhesive dual cure resin cement of a higher strength. And the last one is a light cure resin cement, which is the RelyX veneer cement. Now, what are the advantages of using a resin cement in general? Now remember, resin cements give you a stronger bond to the underlying tooth structure as compared to GIC. So if I have a shorter clinical crown and I am scared that my crown will keep coming out, I will want to use a resin-based cement. Additionally, the incorporation of resin into the cement allows for me to tack cure the cement. Tack curing the cement allows for me as a clinician to remove the excess cement very, very easily. Additionally, with traditional GIC cements, one of the primary drawbacks was dissolution and marginal leakage. With the use of resin and a light cure system, the dissolution of the cement can be almost completely avoided, making the possibility of micro leakage substantially less in my cemented crowns. Let's quickly look at how would I use each of these cements in clinical scenarios. Starting with the first one here, which is one of my favorite cements today, which is the Luting 2 RMGIC. Now, traditional GIC, if I load in a crown and I seat it down, once the excess cement, as you see around the crown, comes out, I would have to wait till the cement completely hardens, and then can I go ahead and remove the excess cement. What often would happen in such a scenario is I would land up traumatizing the gingiva in an attempt to get the cement out. The advantage with the addition of resin is the fact that I can now tack cure the excess cement. Tack curing the excess cement is nothing but flashing the light onto the cement, in this case for 5 seconds. Now RMGIC only has a 10% of resin, which means I need to tack cure the cement for a longer period of time, 5 seconds. What happens after 5 seconds? The excess cement that comes out becomes semi-hard, not completely hard, but does not stay soft either. It becomes semi-hard, which means I can easily go ahead and remove the excess cement in a single piece, which means cleanup is very easy. I don't have to struggle removing the excess cement. I don't have to wait till the entire cement sets completely. More importantly, once the entire procedure is done, I use a glycerin jelly which is placed on the margin of the crown, and I tack cure, or rather completely cure through that. What is the advantage of doing that? Any oxygen inhibited layer that is present at the margin will also get polymerized, which means now the micro leakage substantially decreases, which means I will not have issues of secondary caries creeping in because my GIC cement has dissolved. So RMGIC has become a big favorite for me if I have to cement metal crowns, porcelain fused to metal crowns, or even zirconia based restorations. On the other hand, if I want to lute shorter crowns, or if I want to lute my Emax based restorations, I would either use the U200 or use the ultra strong Ultimate cement. The advantage of using these again is I will get a very good adhesion to the underlying tooth structure. So here, as you can see in the picture, I have just placed my Emax overlays and the excess resin has flown out. I will now go ahead and tack cure this excess resin only for 1 second. Now remember, for RMGIC, which is Luting 2, I was tack curing for 5 seconds. But for U200 and for Ultimate, I only tack cure for 1 second. This makes the cement semi-hard, I go ahead and remove the excess and then go ahead and completely cure the entire system for anywhere between 20 to 40 seconds, depending on the quality of the light that you use. Now, whenever I am bonding an anterior veneer, I don't use a dual cure cement, but I use a light cure cement, which is the RelyX veneer cement. Now remember, veneers are very thin, so light can easily pass through and then cure the underlying cement. So I do not rely on the chemical cure component, which is present in a dual cure system. I would rather use a light cure system because it just gives me that much more time and leeway in terms of doing multiple cementations in the same appointment as well. Here again, I will first seat the restoration with the resin cement, allow the excess to come out, and then tack cure. Again, with the RelyX veneer cement, tack curing is only for 1 second. The excess cement that comes out becomes semi-hard. I go ahead and I take my sickle scaler and I can remove the excess cement, making the cleanup easy, and I don't land up traumatizing the gingiva in an attempt to remove the excess cement. So I, in person, am a big believer in the use of resin cements, and I hope this particular video helped you in enjoying the understanding of the tack cure phenomenon that is available with all resin-based cements. Here again, your host, Dr. Moezai Kakiani, signing out. Bye-bye.